Hello, this is Dr. Irene Hausinger, and this is the lecture to accompany Chapter 4 of your Uppers, Downers, All-Arounders book, Downers. Please note that alcohol will be covered in its own chapter in Chapter 5. Downers are depressants, and they depress the overall functioning of the central nervous system, causing sedation, muscle relaxation, drowsiness, and if used to excess, coma, and death. You're probably familiar with these headlines, and in many of the celebrity deaths, a combination of alcohol and other psychoactive drugs, mostly things like sedative hypnotics like benzodiazepines and opiates, the synergistic effects compounding can very easily lead to an accidental overdose and death caused by respiratory failure. We have major depressants, which are our downers, like opiates and opioids, sedative hypnotics, and alcohol. And then we have minor depressants, like skeletal and muscle relaxers, antihistamines, and over-the-counter downers. It's no secret that we've had a prescription drug epidemic for a while. Besides alcohol and tobacco, the number one cause of preventable deaths in America is the abuse of prescription drugs. America is in the midst of a prescription drug abuse epidemic, mainly opioid painkillers and benzodiazepines. Sales of and deaths from prescription painkillers have gone up 4 to 5-fold since 1999. The diversion of legitimate prescriptions is the main route for acquiring prescription drugs. Diversion means taking them from their intended spot and routing them elsewhere. Tens of thousands of Americans die each year from overdoses, and several million are injured from adverse drug reactions. Besides alcohol and tobacco, the number one cause of preventable deaths in America is the abuse of prescription drugs. About 60% of illegal prescription drugs are acquired from friends or relatives. After alcohol, opiates and opioids are the oldest and best documented group of drugs. They are the principal drugs used to treat pain, which are analgesics, diarrhea, and cough. They also induce euphoria, subdue emotional pain, and suppress opioid withdrawal symptoms. And here you have somebody that appears to be a burn victim. Right. So let's look at opiates and opioids. The United States consumes 80% of the world's supply of prescription opiate painkillers. Opioids can control pain, but they can also cause addiction and overdoses, including many fatalities. Opiates are natural or semi-synthetic derivatives of the opium poppy. For example, opium, morphine, codeine, heroin, hydrocodone, and oxycodone. Opioids are synthetic versions of opiates, such as fentanyl, buprenorphine, Suboxone, and methadone. Opioid antagonists include naloxone, which is Narcan, and naltrexone. Now, it is important to note that in the media, opiates and opioids are sometimes used interchangeably, but they are different. So, opiates are natural or semi-synthetic, and opioids are synthetic. So one of the things that we've talked about is the routes of administration and how important that is. And in addition to the routes of administration, we've also talked about how synthesis and technology have really impacted the way that drugs are consumed, and also the rates of addiction in terms of how the human body can handle something if it's not refined, if it is refined, etc. Over the centuries, opium refinement methods and laboratory discoveries evolved along with different routes of administration, such as ingesting, smoking, injecting, snorting, and skin absorption, which contributed to an increase in the intensity of the effects and consequently the abuse and overdose potential. Patent medicines containing opioids and other psychoactive drugs were heavily abused in the late 1800s and in the early 1900s. Your book talks about this. And if you remember the film Tombstone with Kevin Costner, there's a scene in there where Kevin Costner is having a fight with his wife, and he goes into her bedroom, and in her drawer there are all these empty laudanum bottles. Laudanum is an opiate. And morphine and laudanum had been marketed as a nerve tonic and a treatment for hysteria. And so they would actually market it, is your wife out of control? Does your wife need sedation? And so there were really high rates of addiction among women in terms of morphine and laudanum. And if you remember the book To Kill a Mockingbird, Scout would go over and read to her neighbor, and she didn't really care for doing that. And the reason was that the neighbor was a little grouchy because she was addicted to morphine and she did not want to die an addict. And so she was trying to cold turkey it. And so having Scout read to her helped her take her mind off of the withdrawals. And if you are a fan of Western movies, there are a lot of Western movies where you can see the depiction of heroin when they're at the dentist, or you can buy it for 5 cents at the pharmacy. Wild West days. So if you look at film and if you look at historical films, you can really see the influence of heroin and opiates and opioids really early on. Historically, most drug laws were made for political and taxation reasons and not medical considerations. And on that note, a lot of drug laws came out of fear and racism. There are 5 million to 10 million heroin addicts worldwide and even more prescription opioid addicts. Most opium is grown in Afghanistan, but most U.S. heroin comes from Mexico, which is black tar heroin, and Colombia, which is the white heroin. And that depends on, of course, what it could be mixed with. Okay, white does not mean that it is less impure. There is a type of heroin called pure, but that doesn't mean that it's right from the poppy plant. There's a lot of additives and things to get what you see on the screen here. Most opioids control pain and often induce euphoria. The drugs also suppress coughs and control diarrhea, which is why a lot of opiate addicts have difficulty with constipation. Opioids mimic and manipulate naturally occurring pain-suppressing neurotransmitters, mainly endorphins and enkephalins. There's therapeutic pain control versus hyperalgesia. Physicians sometimes underprescribe for fear of addicting the patient, or overprescribe, leading the patient into dependence. And one of the problems that we're having is with chronic pain patients, it's becoming more difficult for people to get medicine, even if they don't have a history of addiction. And so one of the things that we saw with policy restricting the use and increasing the monitoring of doctors and people getting prescriptions is the increase in suicide for chronic pain patients. Extended opioid use increases sensitivity to pain, both physical and emotional, through processes called hyperalgesia, hyperpathia, allodynia, and hyperkatifia. Nerve cells are sensitized, emotions become magnified, and people hurt where they never felt pain before. So, especially for somebody that's been abusing for a long time, something like a hug could feel like burning or pins and needles. Right? They have an exaggerated sense of pain. And it's advised that physicians should be aware of their patients' risk factors for addiction. Side effects of opioids include depressed respiration and heart rate, constipation, and slurred speech. These side effects worsen as use and dosage increase due to the development of tolerance, tissue dependence, and withdrawal symptoms, which are not life-threatening but make the user feel like dying. Additional complications caused by opioids include dangerous fetal effects, sexually transmitted diseases, abscesses, and complications from polydrug use. Problems involving the drugs themselves and methods of use include overdoses, drug contaminations, infections, and dangerous polydrug interactions. So, polydrug use being taking multiple things at once. In terms of overdoses and suicides, generally overdoses are considered accidental unless there is other compounding evidence. And so most of the time, drug overdoses are going to be ruled as accidental, whereas if it's ruled as a suicide, there has to be other evidence, perhaps a note or previous attempts, etc. Most opioid addicts entering treatment shoot heroin. Treatment includes physical detoxification and psychological processes. However, most people don't start that way. Usually there's a progression from popping pills and then crushing them and snorting them and then crushing them and smoking them maybe over tinfoil or glass and then to IV. There are cases where people go right to IV, but generally, from what I've seen over the years, there is a progression. One of the side effects of smoking things over aluminum foil is that it can cause dementia and early onset Alzheimer's. Burning metal is not a good thing. So one of the things that we want to look at too is not just the drug itself, but what are the behaviors and what are the compounding factors that can add harm, right? And remember, we're looking at harm to others and harm to the user, and others can include society as well. It's important to note that opioid and drug use increases in wartime, necessitating the availability of treatment for returning military personnel. And we have also seen too, especially in terms of agrarian workers, farmers especially, there has been an increase in pain pill use and suicide. And since 2016, with the current presidential administration, there has been even more bankruptcies and farms, not the big corporate farms, but generation family farms going under. And so if you think about farm work, it's very physical and people hurt themselves and then they might be put on pain pills and then a lot of people are going bankrupt. They can't afford their mortgage payments. They can't afford equipment. They're being priced out and monopolized by big corporations. And so you have financial problems, you have physical problems. And as a result of that, we're seeing an increase in suicides from farmers. So much so that the United States Department of Agriculture actually put out a state of emergency several years ago that is still continuing. Looking at specific opioids, morphine is used for the relief of severe pain. If you're in the hospital or you've been to the hospital or know someone that's been to a hospital, it's very common to have a morphine IV drip. Other opioids include codeine, hydrocodone, oxycodone, methadone, buprenorphine, which is Suboxone, fentanyl, and other opioid analgesics. Analgesic meaning painkiller. The opioid antagonists, naloxone, which is Narcan, and naltrexone, are used for treatment. Kratom chemicals are non-opioids but have opioid-like effects and cause opioid-like addiction. Anecdotally, patients may say that they have tried to use kratom to get off of opiates, and I've heard that multiple times over the years, where some folks say that they have felt it was successful. Kratom is something that in smaller doses it's a stimulant, and in larger doses it is a depressant or a painkiller. Okay? And it's gone really back and forth in terms of the FDA looking at it. Is it safe? Is it not safe? Kratom is a leaf that comes from Thailand. So here you have the charts that depict what pain looks like with or without opiate use and tolerance. So when you have patients that have abused opiates and opioids and they are chronic pain patients, we can't just expect them to stop, or we can't just think that, oh, okay, well, your problem is drugs. That's probably not the biggest problem. It might have started with the chronic pain, and the chronic pain is not going to go away just because we take the substance away. So we want to be aware of not creating more problems or deeper problems or driving behaviors further down. And so it is important to look at alternative and different methods of pain management and work with a team, especially when you have somebody that has legitimate pain concerns with dependence. Okay. Okay. So, in general, opioids are going to constrict pupils. Sometimes it's called having eyes that are pinned back. And then your stimulants are going to make the pupils big. So stimulants and things like ecstasy. It's estimated that about 50% of opioid overdose deaths of benzodiazepines, such as Xanax, is also found in the system. Now, we have a benzodiazepine issue, but it has been overshadowed by the opiate issue. However, it hasn't really gone away, so let's talk about those. Sedative hypnotics. Sedatives are calming drugs, while hypnotics are sleep-inducing drugs, and both are downers. Their effects are similar to those of alcohol, like lowered inhibitions and physical depression. Benzodiazepines, such as alprazolam, which is Xanax, and clonazepam, which is Klonopin, are the most frequently prescribed sedative hypnotics. Barbiturates and the Z-hypnotics are other main classes of sedative hypnotics. Barbiturates were more popular in the 50s and 60s, heavy-duty tranquilizers. Benzodiazepines are more popular now. They are calming and sleep-inducing drugs and have always been desired. Sedative hypnotics range from bromides and chloral hydrate to barbiturates, benzodiazepines, and the Z-hypnotics. Benzodiazepines have been the most common sedative hypnotics, but in the last dozen years, the Z-hypnotics such as Ambien and Sonata, or other newer ones like Lyrica and Lunesta, are being prescribed. Attitudes towards sedative hypnotics include both avid acceptance and awareness of their addictive potential. Misuse and abuse occur due to a variety of reasons. Benzodiazepines are the most widely used sedative hypnotics. They were developed as safer alternatives to barbiturates, but in spite of a higher margin of safety, tolerance, and withdrawal symptoms, overdose and addiction still occur, especially when they are compounded by the effects of other downers such as alcohol and opiates. Overdoses can very easily accidentally occur. Benzodiazepines are intended for short-term treatment for anxiety and panic disorders. They're not supposed to be prescribed for years and years and years. They're used to treat anxiety and panic disorders, to treat sleep problems, and to help control musculoskeletal spasms, seizures, and other beneficial effects. These drugs can also cause tissue dependence, slurred speech, muscular disruption, and memory impairment. They should be used short-term for specific conditions rather than as long-term medications. Withdrawal can be dangerous and even life-threatening. So you can't die from an opiate withdrawal. It feels like death, but you can't die from it. You can die if you are tissue dependent from benzodiazepine withdrawal and from alcohol withdrawal. So let's talk a little bit more about barbiturates. Since 1900, more than 2,500 barbiturate compounds have been developed, such as seconal and phenobarbital. They were often abused and widely used until the introduction of benzodiazepines. Their effects are very similar to those of alcohol, and again, they're not used as widely as benzodiazepines. There are other sedative hypnotics such as Ambien, Lunesta, Lyrica, Rosarum, Sonata, and GHB, among others, and they're prescribed for anxiety and other conditions and are sometimes abused for their psychic effects. GHB can be easily disguised in alcohol, and because of its ability to cause amnesia, it has been abused as a date rape drug. It is also used in the gay community as a party drug. You may be familiar with the case of Andrew Lester, who was the heir to the Max Factor makeup fortune, and this comes in with Dog the Bounty Hunter. So Andrew Lester would drug women with GHB and then film himself having sex with them, and they didn't remember. And so he ran away, and they went to Mexico but didn't have jurisdiction to do that, to go get him. And they actually got arrested in Mexico. But it was a very high-profile case. So people they'll black out and they won't know what's happening when they're under the influence of GHB. And in the past, I have seen people arrested for DUI under GHB as well. Using 2 or more downers at one time, especially alcohol with the benzodiazepine, can lead to overdose, respiratory depression, and death. Cross-tolerance and cross-dependence can also develop. So here we have the pyramid scheme that is drug dealing. So we have raw opium selling for a few $100s per kilogram. When it's refined, the price goes up to $8,000. So refining, adding additives, cutting it down, etc. After on the east coast of the U.S., the price raises. It's a commodity. After it's adulterated and divided into 25,000 little baggies or balloons that sell for dime bags, $10 each, with 40 to 50 milligrams in each bag, the gross income rises. Okay. So it definitely is a marketing scheme. When we talk about harms, the drug itself didn't cause this, but infected needles did. This could be caused by using dirty water, reusing needles, bacteria on the skin, not cleaning the skin with an alcohol swab, etc. Okay. And you can just see all the damage here, very painful. Washington State does have a prescription monitoring program, which is twofold. And what that means is that doctors are tallied on what they're prescribing and how much of, and they can be flagged if they are overprescribing. And same thing with users. There's a central database so that if you're going to different doctors and then trying to go to different pharmacies to get flagged medications, then you will be intercepted. Okay. I mentioned naloxone, which is Narcan. It's an opiate antagonist. It's effective in treating heroin or other opiate overdoses, so it brings the person out of it. So opiate antagonist versus an agonist, which is naltrexone. So naloxone is Narcan. Naltrexone is an agonist. So this Narcan will bring you from the brinks of death. Okay. You can actually get this from the pharmacy. You can get it in an injection, or you can get it in a nasal spray and blow the fumes, blow the nasal spray into somebody's nostrils if they are overdosing. Whereas naltrexone blocks the opiate so that you wouldn't be able to feel the effects. It's an opiate blocker. Okay. So here we have a chart looking at the depressant effects of increasing amounts of sedative, hypnotics, or alcohol. So again, it can be very easy to overdose on this. Okay. And benzodiazepine withdrawal versus short-acting barbiturate withdrawal. Okay. All right, so I hope that you enjoyed this, and next week we will talk about alcohol, which is its own beast.